I say chiropractic are more artist also, because every artist is different. We can all move bones differently based on the chiropractor, based on the patient also. So how do you develop your art over time?
You are listening to The Dr. Haley Show, the podcast dedicated to helping you optimize your health. Each episode, there will be an interview or a message to help you discover better health. We will be featuring health radicals on the show to bring new ideas to the table, as well as doubling down on key fundamentals to support you living your best life. Your host is no other than the founder of Haley Nutrition, Dr. Michael Haley.
This is the Dr. Haley Show podcast, and today's guest, Dr. Anthony Ratkovic, I hope I said that right, out of Upland, California. That's in the Los Angeles area. And Dr. Tony specializes in scoliosis, family practice. He's, he does some nutritional counseling and exercise rehabilitation, a very full family-oriented practice. And he's host of the Crooked Spine Show podcast, which you can find streaming on all the major platforms like iTunes. I saw it on Amazon. He's on Spotify. Check out the show. He's got a lot of episodes there, a lot of great content. Also, YouTube, a very busy YouTube channel with a lot of health tips. Dr. Tony, thank you for being
Sure, Dr. Haley.
on the show. I've absorbed some of your content. It's great. I love it.
Thank you. Appreciate it. It's been a long time. We were around. I started practice when the Yellow Pages were still a thing back then, before there was need for a website or YouTube or Facegram and tic-tac-toe, all that stuff too. Before we had to. Not that we have to. Now it's more, if you want to call it creative marketing or basically giving back in a way, and it's everywhere, right? You have to find a way to connect with my patients, future patients for one, too, and just spread the word of health. And then a lot of people out there want that.
I noticed too that you're also teaching some other doctors and doing lots of lectures for them. Maybe is it continuing education hours for them?
Exactly, yeah. Continuing education, I did that a lot last year. They kind of slowed down the program a little bit this year, but I'll still be out there and move things around. A lot of it is just, when I've been practicing for 23 years now, what have I learned? What have I learned good, bad, and different? And even from other doctors too. I'm always looking for mentors. When I first started practice, I had a great mentor, Dr. Nave. And since then, even Dr. Vitale, where I bought my practice into a partnership about 20 years ago. So it's been great.
That's excellent. Why did you get into chiropractic to begin with? I wonder if your story is anything like mine.
Mine was initially when I was going through college, even afterwards too. I wanted to find a career in healthcare, but I don't want to wear a lab coat. I don't want to work in a hospital. I don't want to see sick people all the time. And be honest with you, being selfish, I wanted to golf at least once a week. So I want to make sure I worked out maybe 30 hours a week, took home a good income, but didn't burn myself out. So that was the initial goal. Once I saw a chiropractor, I'm like, you know what? Boom, sold. Right career path for me. And that's why I like to be active, like to be healthy, like to have my time along with still helping people that want to get healthy and well. That's my plan.
That's great. How's your golf game?
It's getting there. It's like the more you play, the more it just goes even or So I tell people, Dr. Haley, another 100 Instagram videos and I'm going to be an expert. That's the plan.
You know, I want to get back to golfing. I gave up for I think it's a bad reason.
Okay.
And well, you know, I started playing and all of a sudden I was slicing everything and it didn't make sense because, you know, I remember just being able to pound it straight down the fairway. And now recently I started following some of the golfers on YouTube.
Got it. Okay.
Which to me is more fun than watching the PGA on, you know, Sunday afternoon with all the greats out there. It's more entertaining. There's, you know, you're getting to know the person on the golf channel. And as they're talking, you kind of pick up some tips. There's this one guy I've been watching. I can't think of his name offhand, but one of the things he tried to do is, you know, break par with a cheap set from Costco. And he would whack the ball and I would see it, you know, maybe break to the right more than he anticipated. And he would explain it. He said, these are cheap clubs and they're flexing too much. And you can see by the line on the club head that, you know, where it hit the ball, the shaft was bent like this,
Yeah.
and that's why it, sliced. It's like, oh, okay. I've been swinging. I didn't know clubs had different flexes.
Okay.
Now I want
Okay.
to go get a stiff shaft and see if I can smack it down the middle again, because I'm probably just, swinging rubber clubs.
That's the thing is when you have clubs, and I won't say even fitted for you, but just for your average swing speed and what you want to do, it plays a lot easier. Even if, like I said, it seems I play a lot of senior golfers too, and they have the flexible senior flex, but they work because they're able to get the whip out of it too. So just how you play golf, everyone's different. There's no like one way to play golf.
I didn't know there was a thing, getting fitted for clubs.
Yeah, especially in
Now I
California.
want
That's
to
like
try it.
people are known for. There's probably one place every 10 miles here to get fitted for clubs.
Yeah, well, I just want a driver, and I'll go to Top Golf, and that's it.
Yeah.
I don't,
Just build my self confidence up that I'm a decent golfer. I'm good to go.
Top Golf is fun for me because you get to hit it and sit down and then laugh at the next person, and you don't have to go find your ball, and it doesn't matter. But I don't know.
It is
Maybe
fun.
someday I'll get
There's
back
one
on the
around the
course.
corner here too. They just opened up about a year and a half ago, 2 years. So it's been busy all the time. People love that place.
Yeah, it's a good time. It's not the same, you don't.
No.
It's not the peaceful getaway, but it's a different environment, and it's
Gives you a
fun.
chance, especially right now where it's gonna rain all day today. So even tomorrow maybe. So if it does rain on Thursday, which is my new golf day, I'll head there instead because it's covered.
Very cool. Very cool. Well, fun discussion. I'm going to get fitted.
Good.
Let's talk about chiropractic.
Okay.
And does that help your game? Can you tell when you're out of
Um,
spinal function?
it's more mobility biomechanics and how the body should move versus the way we sometimes want to make a move. So and I work with my patients all the time about posture, position, line up, how your swing, I guess want to call it circle, how you rotate your body for one, too. So I see some golfers in my office all because they may have a stiff low back, boom, they go to swing and try to torque their body, and boom, all of a sudden it pops on them or spasms on them too. So again, golfers are my job security. Perfect. I love it.
Yeah, I do feel it's like one of those things where, it's something, if one joint isn't functioning correctly because it's a little stiff or a little tight or a little locked up, yeah, all the others make up for it. But if you're off this much, the ball is off tremendously.
Well, then you got
Wherever it
thrown
goes.
off balance too. That can happen to you. How fast you swing if you have a nice rhythm swing too. So where your hands are, a lot of it is once you practice enough, it's still up here. I know some guys that are 4 or 5 handicaps and sometimes shoot up to 10, 12 because their head gets in the way. They can't figure it out. And for me, if I start taking it too seriously, Dr. Haley, I put the clubs away for a couple of weeks, don't even look at them, touch them, and then I get the itch to go play again. If it's not fun, why are you doing
I had a
it?
guest on, talking about the up here. I had a guest on my show. He was talking about getting in the present. And, in this case, he was talking about his son golfing and something that he developed called True Breath.
Okay.
And he said, we're going to use True Breath. And it had to do with essentially before every swing, taking a nice deep breath and hold it for a second. I forget the exact technique, but it was kind of reconnecting with the body and, getting rid of that, everybody's watching thing and just
And the
settling
tightness, the
in and then letting it out. And,
everything starts spinning in your head.
and he explained the difference between, the score before and then the next time he played, practicing that and how tremendously different it was. So
Yeah, there's one of my a guest on podcast show. He had mentioned Jeremy about doing a breathing exercise with his clients, how to relax the body. And when you have it, like for example, I think he said 4 or 5 breaths, 5 seconds in and then 10 seconds out, allows you to reset the system so you get into that rest relaxation state versus the fight or flight or stress state.
Exactly. Yes.
It's just worded differently.
And,
exactly.
Yeah. And in this case, he had called it True Breath, and Andrew Block was the person that developed it. And it was very similar to what you had just described.
And a lot of things, as we know, Dr. Haley, they've been around for thousands of years. We just bring them up once in a while to make sure people know about them. The human body, physiology, how the body works. You want to call it body heals the body. A lot of it has been around for thousands, just different languages that we're trying to get people to understand how to stay healthy simply.
Yeah, yeah. Now, I feel like people in
Mhm.
California are maybe a little more in tune to things natural. I could be wrong. I happen to have an aloe vera company.
Oh yeah, yeah.
If
Okay,
you
okay.
if people are watching on YouTube behind me right now, there's a picture of a field of aloe vera,
Fantastic.
and we ship it all over the United
Mhm.
States. But California is about as far away as you can get from Florida, and we literally ship more to California than we do to Florida.
People want to
Um,
stay healthy,
I
right?
think,
Novella help. What is the benefit that you would tell someone looking at aloe vera? What's the benefit that Californians would want?
yeah, well, for me, most of our business is focused on a better immune system
Hmm.
and a healthy gut.
Hmm.
And everyone wants that because it applies to everything.
Exactly. And Californians want to be healthy and they're willing to pay for it. They understand that they may see their, I have a lot of people that have older parents or older family that weren't healthy. And they're going, oh, how do I avoid that by doing something simple for my health on a daily basis? Take supplements. Take something that's going to affect you long term so your body can stay healthy for longevity and look good too, right? I mean, that's part of it is you want to make sure you look good, feel good. And Californians they're willing to spend their money and work hard for their money but spend it on the right things such as health versus the next toy.
Yeah, yeah. I've grown up with that mentality, but
Mhm.
I'm not surrounded by it here in Florida. There's a lot of, I'd rather get my face tightened up than, there's a lot of people are more concerned about how they look, but not their health on the inside. They want to look healthy, but not necessarily be healthy.
And people are looking to go, how do I live in my stick into my 60s, 70s, and 80s, even 90s in a healthy quality of life, right? I do some other side work too. A lot of it is wanting people to stay healthy. You have to take care of your health now for the next 20, 30, 40 years. And people
Yeah.
understand that yeah, you want to look good, that's fine. But what do you do on the inside so you can stay independent? You can maintain your own health. Once you get to the point where and realize healthcare in California is expensive for people individually because of copays, deductibles, they know they're going to pay out of pocket. And what do I want to pay back pocket for medications just to block the symptoms of feeling good or bad, sorry, feeling bad, versus actually heal the problem, making my body feel bad. Find the underlying cause through aloe vera, through supplements, through vitamins. And people ask me all the time what to take. I'm like, you got to figure out what's best for you. At that point, not only take it today, but take it long run. So at that point, your body can stay healthy no matter what state you're in, health state, mental state, physical, physiological state, anything.
Yeah. I kind of feel like chiropractors have been on that line of thinking far before the term functional medicine
Or physical
really
medicine. Yep,
made
exactly.
its
Both. Yeah. Hmm.
and it's the thinking, okay, this is your symptom, and if I treat the symptom, I could make you think you're healthy because you don't have the symptom,
Hmm.
or I can find the cause of the symptom and figure out how to address that, whether it's getting something out of your life that's causing it, or rehabilitating, strengthening, improving, making it more flexible, work like it's supposed to.
Well, a lot of it is I think
It
people once they see a chiropractor, their chiropractor as getting them out of the chronic pain which they've had to take medication for sometimes weeks and months, then you have a chance to open the window. Okay, what else you want to get healthy? Let's find out what the cause of your chronic pain was. Let's fix that posture issue if that's what it was, or how much you don't do, or increase your stretching and increase flexibility. And go, what else can I do? And it's almost continuing to fine tune their health. Once you give them that bit of hope, medication is always the answer. I can actually do things for my own health, walk, stretch, exercise on a daily habit basis to get my health better and stay better. That's why I have patients come to my office they've been in my office for 15, 20 years because they see the benefit of chiropractic, but also me being just their verbal guided coach. Hey, what are you doing for your health? How's your diet? How's your nutrition? Well, I stretched today. I'm like, yeah, because I knew you're coming in, but are you stretching every day that I don't see you also? So I try to make them more accountable for their own health. Because I can't diet for you. I do my own stretches. I can't time for your stretches. Can you make sure you do certain things for you? And I'll give you the tools. I'll send you videos how to stretch, what to do for your body based on your x-rays, based on your lifestyle, what's going on for one too. But you have to do the work.
Yeah, I completely agree with that approach because I don't feel it's my job to get the patient well.
Oh.
If it was, well, you're going to have to come 3 times a week forever, because I have to make sure your spine stays functioning at its maximum potential all the time. And if you're not doing anything to maintain that, you're going to need me before 2 days from now.
And part of it too is you go to your doctor. It sometimes takes 2-3 weeks just to see your doctor. Sometimes just a video call. I had a patient come yesterday and goes, "Yeah, I've been seeing my doctor for about 3-4 months now. Postpartum, had a baby back in October, and he doesn't want anything about my back pain." I go, "Well, it's not bad enough yet." And she says, "Well, I don't want to take medication." When he has no answer for you then. Until you have neuropathy down the leg where you need PRP shots, cortisone shots, maybe surgery, what do you want them to do? That's not what they do. I told her, she's been my patient before, let's fix your back. At that point, calm the chronic pain down so now your body and your mind can handle more stretching, more exercise, get yourself healthy again, versus the short term, we're going to go back and forth with your doctor and not get no results.
Yeah, and for people listening, when we talk about medications, it's not that we're 100% against medication. There's a time and there's a place for it. But if you're using the medicine, you have to say, okay, why do I need this medicine? Because we need to address the problem so you don't need it anymore. If you're on something that's lowering your blood pressure, well, why is your blood pressure so high? Do we want to just take it? Is it because you have a lack of blood pressure medicine and therefore you're supposed to be taking this the rest of your life? Let's do what we need to do. Make sure your weight is proper. Let's make sure your spine is functioning like it's supposed to. Make sure you're getting good rest, good nutrition, exercise. Let's figure out what's lacking in your life and get it fixed.
Well, and I always ask them first thing before that too, Dr. Haley, is do you want to change something? Do you want this to come back or do you want to get better so it stays better? They go, I want to get better. Good. Do you want to do the work? They go, what's the work going to be? Well, it's going to be this, 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 and this. And slowly over time, build up a habit of doing it every day so it doesn't become work. Are you okay with that? What's the time frame? I'll go usually about 3 months. Not just seeing chiropractic, but as you get better, again, we'll back off the chiropractic as you do the stretches, exercise, strengthen, change your diet if you need to. At that point, it's going to be your job to do that. Are you okay with that? They go, well, I'm like, then don't start. That's fine. Just keep taking the meds. When you get tired of that med, get another med for 1, 2. Keep refilling your stuff. And I always ask them, when you get to the pharmacy, how do people look? Do they look healthy or do they look sick? They go, they kind of look sick. I'm like, well, that'll be you. And if you're 30, that'll be you in 10 years when you're 40. They go, really? I'm like, it's up to you. I said, look, I do what I got to do to get healthy. It's not easy. It's work. It's like you said, getting up early every day, get your workout in, watch your diet, watch your water, everything you got to do. But it's life.
You enjoying the show thus far? One of the many health secrets that we have covered on the show is all around aloe vera, specifically drinking raw aloe vera. Our aloe vera has helped our customers effectively heal their gut, increase their intestine health, lower inflammation in the body, eliminate and or decrease acid reflux, have glowing skin and hair, and so much more. Now, as a frequent member of our audience, you will be exposed to exclusive specials and coupon codes for the awesome products manufactured by Haley Nutrition. That's right, for simply being awesome and tuning in. You can get a mini discount to help you optimize and better your health. To see how we can help and support you on your health journey, tune into the episodes and listen for coupon codes that you can use at www.haleynutrition.com before you make your orders of raw aloe vera. Once again, it's www.haleynutrition.com. Now, back to the show.
You know?
Absolutely.
Yeah.
Arnold Schwarzenegger didn't get fit in one visit to the gym.
No. Hours. I remember I watched this. He had some short videos a couple years ago, just like short little on Instagram or Facebook. It's like, oh, poor baby, you've got your earbuds. You can't go to the gym today. It's too cold outside. Oh, poor baby. Then don't get strong. Just stay home and do nothing. You know, it's putting the work in no matter how you feel because your body requires it.
Yeah.
But it takes time to get to that point based on how severe someone is away from health. Then getting back to what quality life, the maintenance. I said, I don't have to see you every day. Once you're healthy, you have that better state of health. You're going to know when to come in and see me. You know when something's off. And like, as you know, doctor, like, everyone has different symptoms. It might be their neck gets tight, their back gets tight, they have a little numbness in their fingers, or their toes. So I'm gonna know your symptom when what's going on. So I want to make sure my patients understand I'm here to help them learn how to become their best doctor themselves, so they don't have to see me.
Yeah, yeah. So, what is chiropractic for the layperson
Mm-hmm.
that doesn't really get it? How would you describe what it is, what it does, and why people would need it?
Good. Chiropractic as a treatment allows adjustment of bones. I just keep it real simple. Adjustment of bones to allow relief of nerve pressure, increase muscle flexibility, increase ligament flexibility, make your body obviously feel better, and over time reset your nervous system so it stays in a relaxed state instead of the stress state where your body always tenses up, maybe throughout the day. Your nerves affect your mind also. So at that point, you have more of a positive outlook of what you have to do to get yourself healthy that day. And over time, as you maintain chiropractic with stretching, with exercising, you maintain a healthier state of overall health so your body can stay healthy, avoid arthritis, avoid neuropathy, avoid long term physical conditions by doing that for a year and years and even decades.
Yeah, and let's dig a little deeper
Sure.
on that. And I'm reminded of a comedian that I went to see when I was in chiropractic school. So, which means we're talking about 1990.
Yeah. Mm-hmm.
And I'm completely entertained by this guy. And he's talks about when he went to the doctor, and the doctor's, tapping on me and stuff. What's he doing? We call out to Boatman. And what kind of doctor are you? Well, I'm studying to be a chiropractor. He says, oh, chiropractor, you guys think you can heal a heart attack with stretching exercises? And everyone laughed, and I did too.
Yeah, like, yeah, that's
Um, because it's not stretching exercises, it's the chiropractic adjustment.
mm-hmm.
There's a difference. Not that we can heal the heart attack, but the chiropractic adjustment is much bigger than a popping, cracking noise. And you had mentioned numbness. Some people will have numbness or tingling or a little less sensation in their fingertips or their toes, or maybe in the back of their head, or wherever the case it is. And that's a slight interference with a nerve that stops it from functioning as it should. So that sensation is actually missing. It's being blocked. The signal's not getting there just because of a little tension. And I've had that. I don't know. Have you ever had
Yeah,
that?
that's why I became a chiropractor. I was adjusted by a chiropractor when I was working as a chemist and healed my back.
Yeah. Now, as a kid, when I experienced it, it was because my, legs were crossed funny or something like that, or I, was resting my arm and there was being pressure put on that particular nerve, and I, lift my arm up and shake it off, and eventually the feeling would come back.
Yeah.
But now that I'm older and we've had our history of injuries and stuff, sometimes we get that tension in our spine and the nerve is being irritated and we get the numbness. And for me, if I have that and I get the chiropractic adjustment, it's an instant release of that nerve pressure. But I bet you have a story or two where a patient had maybe a nerve that was pinched, possibly going to an organ.
Mm-hmm. Well, you mentioned even the
And
heart attack too. I had a patient, actually two patients come in, and they said, I have chest pain. I'm like, okay, first of all, have you seen a cardiologist? Have they cleared your heart issue? Yeah, it's not my heart. I go, fantastic. We know it's not that. So I tell them, when do you feel the chest pain? And they go, when I'm stressed. I'm like, perfect. You're a perfect chiropractic candidate. Boom, let's get you adjusted. So we're able to reset, like we talked earlier, reset their nervous system to a lower, healthier, relaxed state so you don't have their symptom of maybe neuropathy, numbness, tingling, burning, sharp pain down the arm, down the leg, or in her sense was more the chest pain. So it's finding out, is there a link between their stressor and their symptoms? So when I adjust you, does your heart feel better? Yes, always clarify, because the nerves from your back, I just don't from the back, T3, T4, go into the heart. Even your vagus nerve 2 from your cranial nerve 10 goes to your heart also, making it relax. So maybe just your symptom is your heart, but your overall body, all your organs, all your muscles now get a relaxed state. You mentioned too, when you get adjusted, it goes away immediately. I always clarify. I go, that's why it's neuropathy, because if it wasn't, we'd have to do massage, physical therapy, stretching, exercises to release it. But that one adjustment instantaneously, as you told me, patient number one, whatever, at that point, now your symptom automatically went away. I said, that's neuropathy. We adjust the spine, release the disc pressure, nerve calms down immediately. It may not stay there, but we can get it started so we know the right approach to getting you healthy.
Yeah. Now, it doesn't always go
No.
away with one adjustment,
No.
and sometimes it might even be worse the next day.
Mm-hmm. And a lot of it is you have to explain to them. That's always ask. I go, you may be okay now, or you may not feel good now. Let's say you do next 24, 48 hours. Let's see what pops up. Sometimes we'll overstretch ligaments or muscles like the first time working out, and you might be a little sore because things are so tight. Can we release that pressure over time? So as you know, you want to get healthy, you want to get better. Now, over time, you'll get better. It may not be a quick fix for you because it's been so bad. Let's make sure over time you improve so your health gets better and stays better.
Yeah, I've always felt pretty good about it. And I'll tell my patients, if you feel a difference in this exact area where you're having a problem, whether it's numbness in your fingertips or pain in the neck or whatever the case is, and I make a change to the spine and that exact symptom is changed. Well, now I adjusted exactly the right place. If I took something that was so stuck and released it and almost had to tear through scar tissue, there might be some new inflammation in there that takes up space. It takes up space. Swelling takes up space, and it could pressure that nerve. But now you're moving, and I give you the exercises. We're going to pump the inflammation, get it out of there. You're going to do better.
I think when you give them that step-by-step process, you're being transparent with the expectation of how the body is going to heal for them, not just everybody, because you know their body better than anybody else.
Yeah. It's definitely a fun thing. I remember one of my earliest patients, and it was an infant. And a friend of mine who was dating someone that had a young infant. And she was completely skeptical about chiropractic. But this friend, he was really actually a patient, and you kind of become friends with your patients, get to know them.
Personal professional, yep.
And he convinced her to bring this infant to me, and with Erb's palsy from a difficult birth. And she was very skeptical. And well, let me see your baby. And I remember putting her on my shoulder like this, and my hands immediately went to palpate the atlas. And I felt an immediate giving away just through palpation. It was like, oops.
Oh, you little pause, like, okay, what happened?
Yeah, well, no, I knew I did it exactly right, but I know this is not going to look good for my skeptical mother here. So it's like, instantly, within a second, I handed the infant back and I said, she's done.
Yeah.
And she's like, oh, yeah. And that's going to do something, and looking at her boyfriend, this is, guy's crazy. She called back a couple hours later crying because Ashley was using her hand for the first time. Not doing push-ups or anything that, but, she sees her starting to use her hand as she's, trying to crawl around. And the physical therapist, what did you do? What's going on? But for me, it was awkward because it was accidental that in palpation that I actually adjusted. And I could tell it was perfect, and I knew it was perfect. And I was a young chiropractor. I'd only been practicing by that time, maybe 2 years.
Yeah.
Now, what's it like now compared to back then? Do you remember trying to feel things and figure out what the problem was?
My first adjustment was my roommate, not a chiropractor, Chris Seaton. And I had my portable table. I had portable tables back then. Go practice at home on your friends down that won't sue you, hopefully. And I hit his back really hard, just with a piezoform contact, boom, and it popped. I ran the room for maybe a minute or so. Just ran on. I'm like, yes, I got my first one out of the way. Now it's like I do between 60, 70 people a day. I'm like, normal. That's my normal day. But I remember one story too, same thing. Moms and babies are great. I like seeing the moms either pre-birth or even after birth too. One of my first ones when I bought into a practice, I adjusted a mom in the morning. Husband came in also, had not slept basically since their baby was born, probably a good month or so. So I adjusted her, and her neck popped really well, or no, it adjusted really well. And all of a sudden I said, go home, relax, put some ice on it. And I always say, here's my number. If you have any questions, call me or call the office. At that point, I want to make sure the first 24 hours or so, 48 hours, they have access to now ask the questions they may have forgot to ask, medical amnesia, when they leave the office. Within 2 hours, the husband calls me and goes, my wife can't wake up. I'm like, crap, what's my malpractice insurance coverage again? What's my name? And all of a sudden, well, did you try?
She was catching up on her sleep, I'm
Yeah,
guessing.
basically it's like, okay, did you try to wake her yet? Is she breathing? He goes, yeah. What happens when you try to wake her? She's real grouchy. Then let her sleep. She's exhausted. But when you're first in practice, you're like, okay, because in school, at least out here, they always go, if you do something wrong, it could be this. They almost like scare you to even adjust somebody. That's why I had good mentors that say, hey, don't worry about it, you'll be fine. But a lot of it is you get those sometimes, like what's going on. I even had people before too. They're 2 weeks past their due date of delivery, come in for the adjustment, boom, that day they have their baby. Yeah. It's just amazing how chiropractic can help someone release that stress, that tension, so now they get back to a normal state of health. And instantly.
Yeah. Seeing that many patients a day, for those listening, do the math. With each patient, you might move more than one bone.
Neck, mid back, low back, boom, 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 both sides, blah, blah. Sometimes people want the neck, that's fine. It's almost like you just...
So, if you did 5 different adjustments per patient, times, keeping the math easy, let's say 50 patients.
Yeah.
That's 250 adjustments in a day, times maybe 5 days a week.
3 days a week.
Keeping the math easy, we'll say 4 days a week. We'll just say 1,000 adjustments per week. And let's pretend there were only 50 weeks in the year because, hey, we,
round
vacation too.
Stuff off. Yep.
Well, you start thinking about how many adjustments per year, and then you've been practicing over 20, 25 years or something like that.
Yep.
All right. Mathematically, that's an incredible number of chiropractic adjustments. And I think it's funny because on YouTube, people will critique the chiropractor. Oh, they're doing the same thing to everyone. It could look the same.
Yeah, it could look the same.
But when we've moved that many bones, it's instant. Our hand goes to the right place because it's feeling everything at the same time. And it pushes very, very specifically and accurately. It's a seasoned professional. Like when we see people on, YouTube performing their skill, that's all they've ever done, whether it's cutting coconuts or stitching on patches on shirts, or whatever the case is. It's like, whoa, how'd they do that? They've been doing it for years.
Unconsciously. When you walk in a room, you know the person already. You can see their spine in your head. The file opens up for me. Boom. Okay. And I can go here. They had this last time. Headache here, occiput there, SI joint dropped on the left for 1, 2. You have it in your head, what the steps are. And I do a leg length check. I do a shoulder check for 1, 2. I do other things. And sometimes every time based on their leg length, what they have going on. But a lot of it is, okay, I know the person, anything new going on, cool. Lie down, get you adjusted, make sure I got everything. I'll double check everything. Let me know if it feels good. Boom. We're done in less than 5 minutes. When you have that, if you want to call it that recall, you can do. But again, we talked about earlier, it's waking up early, getting your exercise in, do your stretches, get your body ready, your mind ready too. So now you're ready to walk in the office and boom, knock out 50 people in 3 hours. Just knock them and go. Man. A new patient here, boom, boom, boom. It's almost like when I expect that, I'm more like, why am I sitting down right now? I should be standing, seeing another person. Boom. It's something you have to, and again, practice. What is it being an expert? It's time, knowledge, and that's combination. So the more time you have with people, seeing patients, gives you that expertise to now know, even though you helped Johnny 6 months ago, okay, what's going on with Johnny? Boom, I got him. Let's get him treated. Boom, get him out of here. You don't have to waste time. I do my continuing education course too. When I do my lectures, my speaking, it's the adjustment technique. But part of that is the pre-adjustment. Take care of yourself first. That point, you can take care of your patients.
Now, when's the last time you got an adjustment?
A week ago. I do once a week. Minimum, based on my workouts, sometimes more, based on my golf, help my mind out, based more.
Yeah.
but minimum,
And
like,
I expected
I
that.
work with a partner too, so it makes it easier for me. Hey, doc, boom, let's get each other adjusted.
Yeah. Yeah. Now, you know who Sid Williams is?
Yes. Hmm?
Sid Williams, one of the most vocal chiropractors, very known in the up until the I don't know. I think he passed maybe in the
Yeah.
late '90s or early
It's pretty
2000
2000, I
something.
think. Yep.
But author and speaker to a lot of the chiropractors, teaching them chiropractic philosophy. I do remember seeing him at one of the chiropractic conventions where we were getting our CEUs,
Mm.
and one of the older guys was adjusting Sid Williams, and Sid Williams is face down, and it was humorous because we're all gathered around watching Sid Williams, the master, get adjusted. And he asked the guy, he said, "What are you doing?" And the guy goes, "I'm feeling for a hard spot." And said, "Well, what are you going to do if you find one?" He said, "I'm going to push on it," which was hysterical because it kind of dumbs down chiropractic. But the reality is, a seasoned chiropractor, when he puts their hands on anyone, without moving a hand, you could say, "What are you feeling right now?" "Well, I can feel your shirt. I can feel your temperature.
Mm.
I can feel the tone of the musculature. I can feel your heart beating." There's a lot. I could feel movement from your breath. You feel all of these different things, and part of your hand could feel one tension and part of your hand can feel another tension at the same time, and you're processing all of this instantly because you've done it thousands and thousands of times.
And I think I say chiropractic are more artists also, because every artist is different. We can all move bones differently based on the chiropractor, based on the patient also. So how do you develop your art over time? I look at, for example, football players. It looks like they're doing like just their everyday daily drill, but they've done it again thousands of times. They work on their body every day. It looks simple and easy. You pick any sport, even golfers too, but for but they spend hours and hours and hours not only developing their craft but maintaining that practice, keeping their body in shape, to be their mind. The sports psychologists in general, they're so busy now because people want their head straight. They realize most of the problems are between your two ears, not in your swing, not in your throat, not in your biomechanics.
As a thank you for being a fan of the Dr. Haley Show podcast, throughout March of 2025, enjoy 10% off your entire purchase at HaleyNutrition.com. The coupon code is HOPEFUL, HOPEFUL, because we are hopeful to have aloe vera back in stock before the month is over. In the meantime, we thank you for your patronage of our other products. Consider combining this coupon with our already discounted and on sale bundled products. And enjoy the rest of this podcast. Who are some of your favorite guests on your podcast?
There's one, a Dr. Brian, chiropractor. He's in his late 70s now, down street from me, real local guy. He has been a practitioner over 40 years. So he's more of like someone, we ever know someone who's older, like in their 90s, but they're healthy physically, mentally? I go, what's your secret? What do you do that has made you maintain that passion being a chiropractor? Healthy guy. He rides his motorcycle all the time too. What is your secret so I can take notes and then hopefully get to your point of view? Happy guy, wants to retire. His wife just retired a couple years ago. He's like, I love my practice. She wants to travel more. So I kind of want to sell it to move on next thing. But he has patients been there for 20, 30 years that just follow him because his personality, like yourself too, it's the positivity of being a chiropractor and helping people long term so your body can stay healthy. When you have that passion, people know you're being genuine. If you're going in for the money, doing whatever you want to do, cool, whatever. But you really want to help people. I call it a family practice because you can help the family generational over time. So you see the parents, kids, grandparents, great grandkids for one too. You're seeing everyone line up to get healthy for the long run. I think that's the goal. That was probably my recent favorite one. I've had other ones who have been great. It's just something to where I always pick something from someone, even if it's not chiropractic. Well, how are they helping people? What's their goal? And they always talk about too the autonomic system, how the nervous system works, even their own field for one. But it's almost like that carryover to chiropractic is really about just true health. How do we get there, maintain it? At that point, make sure other people know how to get it to. That's what it comes down to. Number one, new patient, if you want to call it source, is just referrals. You take care
Yeah.
of people, they'll send their, because everyone's going to have back pain, neck pain, right? Sometime in life. Where are you going to go? Where either you trust someone or you know someone who's gone somewhere they can trust, like a mechanic. You want the personal referral because they can get that trust.
Yeah. Yeah. What would you say to someone that's listening but has never been to a chiropractor? Maybe they were told, you know, "Oh, I went to a chiropractor and he hurt me or something like that."
I always ask them, what I always ask them, what do they do? What kind of problems you had? Did it require, in our mind, an X-ray, something to kind of diagnose it properly? Maybe severe neuropathy for one too. But it's almost like find someone that you can trust, and give them a quick checklist. What does a chiropractor do? Does he take X-rays if needed for one too? How long do you spend time with the patient? How long is his initial exam? So you get an idea of who they are. And by putting videos out like this too, we understand, you get the sense of that doctor's personality, and do they really care? That's what it comes down to.
Yeah.
And it's a lot of it's doctor can ask the right questions, but can the patient see that doctor really cares about getting you better? Even if it's not in his office, but getting you better no matter what's going on with your body.
Yeah. And chiropractic is one of those things that, you know, even when it's bad, it's still pretty good.
Hmm?
It's one of the safest healing professions, which is why our malpractice insurance
Whoa.
costs, a pinch compared to what medical doctors have to pay.
So it's like anesthesiologists, the highest malpractice insurance because they have the highest risk. So correlated, we're the lowest malpractice, we have the lowest risk. I think
Yeah.
sometimes chiropractors, when I talk about seminars too, is the communication isn't there. That's not taught in school. At least out here on the West Coast, it's about passing the boards, get your boards done. Good luck in the world. You know, it's almost like you have to learn communication on your own, which is fine, but doing it early enough. If I've entered my office from the local high schools and colleges, they come in to learn the bedside manner. How do
Yeah.
you get that down? So no matter who walks in the door, an angry patient, a happy patient, whatever's going on with their life, you can help them realize, hey, this adjustment's going to help you with what you feel stressed about right now.
Yeah. Yeah. That's a good word.
It's communication. It's not that they got hurt from a chiropractor. The chiropractor can explain it can, like you talked about earlier, it can make it sore to where we have to break things up. It has to be communicated that way.
Yeah. I didn't quite have that bedside manner when I first started.
Me
That's
either.
for sure.
Me either. I didn't even want to be on the phone. I'm like, just lie down. I don't know. Just lie down. But the thing is, it's almost, you have to develop that to be communicating what chiropractic is. Again, 2025 it is. Right now, people still don't know what we do. And why? Because they've been down the medical route. Now they're desperate. That hasn't helped them. They want relief now. At that point, they're desperate enough to see a chiropractor. Finally.
Yeah.
I show them an x-ray. They go, is that the back? So we'll have to explain exactly what the bones are to you now. But it's something where I want people to spend the first visit educating them on what the problem is, where it's coming from, so they get a sense of being respected too. Versus go to your medical doctor, especially here in Southern California, you have 5 minutes. You have 5 minutes to tell doctor everything. Okay, here's the pill. I'll see you in 3 months. They want someone to listen
Yeah.
to. They want someone to build trust with. And I may see someone maybe just once, but I gave them the best experience I could as a new patient because you're traveling or something, because now they know what chiropractic is.
Yeah. How'd you come up with the show name, The Crooked Spine?
I don't remember. Maybe I saw a spine somewhere. Maybe something like that. It was an inspiration. I woke up and I'm like, Crooked Spine Show, we're good. But a lot of it is too, it's maybe it could be something else. It's just doing it and doing it over and over and over again. So it's on, I'm not sure if you're talking about any podcasts I have right now or YouTube videos from my podcast. It's adding more and more to whenever I can, being on shows, having my own show for one too. So people understand what healthcare is. I've done well enough. I could not retire tomorrow, but practice is solid. But how do I now give back to people that want to get healthy, don't know how to get healthy, or as a host of a show, bring someone on that can help promote their book, their business. A lot of chiropractors too, what they do in their office, to get them the exposure for their area. People being a podcaster, people from all over the U.S., through Europe. I had a show lined up for Thailand, but they had so much power issues there. I was like, they would never happen for one, two, you know? It just expands your ability to help more people. They may not they might even need chiropractic, but they know where to do other things by yourself. And I'm learning too, right? I learn more things from sometimes my guests based on what I can incorporate in my practice and my own personal health to now live a healthier life and be an example for my patients.
Yeah, if you ever want to be a master of something, teach it.
Yeah. Mm-hmm. And you learn as you go. But I know some people that are thinking about doing a podcast or may have done one or two shows and quit. It's going to take time. It's not, the ROI is going to be low. It always is. But are you happy doing it if there is no ROI?
I definitely enjoy podcasting. I love having guests on like yourself where, iron sharpens iron.
Yes.
And you get to learn from every single guest, some little nugget. And for the audience who maybe can't tune into every podcast, they're getting tons of nuggets. So hopefully
and all of it is, it's when someone needs a chiropractor or health advice, they're going to search a podcast or YouTube channel or some platform. So when you're on there consistently, then you can reach them when they need you. That's what I tell people. Good.
Are you a consumer of podcasts?
Of course,
are you listening to others?
I have my own. I use Overcast. That's my podcast app. And I do anything from healthcare to history, to finance, anything. I like to go for long walks or play golf, like you had said. At that point, put a podcast on. Go for a drive, put a podcast on.
Yeah, I'm not one of those guys in the gym. I always have my headphones in, but they're not actually in. They're like bone conduction,
Okay,
so they kind of sit on the outside.
Got it. Okay.
They're waterproof, which is great because you can swim with them.
Yes.
But I'm always listening to a podcast when I work out. But it's not like listening to music where if someone talks to you, you have to turn it down.
Yeah.
You can hear everything around you still. So you're taking in the podcast, but you're not, shutting everyone else off. And it's kind of obvious when you have the little white things dangling out of your ears. It's like, oh no, I'm not here right now.
And for me, I like to work out, like just get in, get out for 1, 2, hat on, earbuds in, boom, get in and get out, go. But it's something, everyone has their own little taste to it. But when can you learn something new? And I got to tell people, my students, my interns, is you have to listen to an hour of a podcast to get maybe 5 minutes out of that. They could be useful for you. So my interns, when they come to my office, when they're not seeing a patient, because I rotate them, here's a podcast, here's a YouTube video to watch. And what are you going to get from it? Give me a 1 minute spiel of what you got from it. So I'm helping them learn how to learn from different people, usually my guests, that they can pick stuff up. So learning that versus just book knowledge.
Yeah. Yeah, we got some book knowledge, but let's apply it.
That's nice. It's nice, but how do you implement it into your life? At that point, make it part of your life so you can enjoy that benefit long term and give yourself time to. I said, it's not a race. People actually doing the LA Marathon this weekend, but it's something to where it takes time to train your brain how to learn. And again, you're in school, so focus on that. I have two that are thinking about becoming a chiropractor and we work in my office down the line, is getting them to realize, do your book knowledge now, get that out of the way, get the boards out of the way. Then when you get close to that, we'll talk about in the office more things to read on your own. I even wrote down, when I had a mentor that we really paid for, I have like 3 or 4 notepads of information that I just wrote everything down. And I still repeat to myself these days. A lot of it's mindset. It's the old coaching programs for one, and how to get people to, again, communicate with the next patient, how chiropractic can help them over time, and then learn and do that on a daily basis. But it takes time. It doesn't happen overnight.
It takes time.
Yeah.
Well, hey, Dr. Tony, I want to thank you for joining us today and imparting your wisdom to my audience. For those that want to get in touch with Dr. Tony, I'm going to make sure I have links.
Good.
Either in the description of whatever platform you're on. You'll be able to visit the website. What's your website?
Website is Euclid Chiropractic Inc., which is inc.com. And you'll have my links to my Facebook, Instagram, TikTok, YouTube, and just my cell phone number too, and my office cell phone number. I give every my patients my cell phone number, but no one calls me Dr. Haley. I don't think they like me. That's what it is. I don't know. But a lot of it is just communicate with patients. I'm Southern California. I'm in Upland. Ontario Airport. That's our kind of our base for one. But if you need help finding a chiropractor in your area or health advice for one too, I'm all ears. I like helping people internationally if need be, just to get people healthy.
Yeah. Yeah. Check out the Crooked Spine show
Yep. Mm-hmm.
on Apple, on iTunes, on Spotify, Amazon, wherever you absorb your podcasts. I listened to one this morning when I was working out.
Nice.
And was that with the Dr. Versal, the headache guy?
Yeah. Yes. I did interview with him from my podcast.
Yeah.
Okay. Yeah. Good. Yeah. And then Dr. Crippen afterwards too. Real good guy in the Midwest. He has a new book out, and he's a younger doc too. Really good guy, and the philosophy of just how health should work. So he was a good one to listen to. Also, my recommendation. I'm chiropractic subjective, I guess.
That'll be my next one.
Good. Thank you for listening. Yeah. It's
Thank you, Dr. Tony,
put information out there. People will find when they're ready for one too. But do it more because you like to do it. Podcasting, YouTube, whatever it is, too, videos, because you should benefit your patients if you really want to help them get healthier.
Yeah. People, get adjusted.
Yes.
Thank you, Dr. Tony.
You're welcome, Dr. Haley. Keep up the good work on your end, my friend.
I hope you enjoyed that episode today on the Dr. Haley Show. Make sure to hit subscribe on whichever platform you are listening to this. If this episode made you think of someone, go ahead, take a screenshot, and share this exact episode with them. You can catch the show notes for this episode on www.drhaley.com. If you want to geek out with Dr. Michael Haley on other radical health topics, be sure to check out his YouTube channel, where he posts exclusive video content. All the details are at www.drhaley.com, and we can't wait to hang out with you on the next episode.